Post-traumatic stress disorder occurs usually after a traumatic event that may or may not be consciously remembered by the patient. The big hallmark of PTSD that separates it from other anxiety and depression type disorders would be re-experiencing the situation. Anybody can struggle with PTSD. I see it a lot in my patients, and it can be, it doesn't even always have to be an event that we traditionally think of as traumatic. So we traditionally think of things like people that have wartime experiences, or people who are victims of violent crime, people who are victims of physical or emotional abuse. But it can be smaller things than that. It can be somebody tried to break into your home. It could be an unhealthy marriage. There are traditional treatments for PTSD, and then there are some new things on the horizon. Traditionally, we often use therapy, lots of different therapy techniques. The traditional sort of therapeutic way to treat people would be to do exposure therapy, where you slowly, in a very safe environment, usually a clinical setting, re-expose patients to small pieces of what traumatized them, so they can re-experience that event in a safe environment and sort of relearn to hear loud noises, or to be in relationships, or to have certain types of conversations in a safe environment that's not associated with any type of trauma. And they can form a new neural pathway and sort of shift their reaction to those sensory pieces in a different way. And exposure therapy is still used all the time. Same with traditional antidepressants and anti-anxiety medications. Those can really help change your neurochemistry so that you don't have these big physical reactions to certain types of sensory input or reminders. If you feel you're experiencing the symptoms of PTSD, anxiety, or depression, feel free to reach out to me and I can try to help you.